What happens when we begin to realize that the 200-year experiment we've called the American healthcare system has failed? Tune in to Awakened Wellness with Mylaine Riobe, MD, and join the conversation about how to heal our broken system to reverse our current health crisis. The entire world is looking for answers, and the truth is hidden in plain sight. Learn how spirituality, ancient traditions, and cutting-edge science are merging to create a new paradigm of wellness every Wednesday at 12 a.m. and 12 p.m. Eastern Time, with live video shows every first and third Wednesday at 12 p.m. Eastern Time, when you can call in and ask the questions that matter most to you.
Hello and welcome to Awakened Wellness. I'm your host, Dr. Mylaine Riobe, and today's topic is going to be the prevention of type 2 diabetes and high blood pressure for millennials. And so you're listening live here on Dream Vision 7 Radio. And so millennials, unfortunately, are, as we've talked about before, being predicted to be the unhealthiest generation in American history. And just on the tail of that information, we got even worse news for Generation Z, which is the generation that follows millennials. And so, you know, people are, of course, understandably scratching their heads and asking, you know, how is this happening when millennials are the most health conscious generation in American history? And so it becomes really perplexing when a generation that has been doing from a very young age all it can do to stay healthy is getting sicker than generations who have maybe not done as much to stay healthy. And so we're going to tackle that today. The two most common chronic diseases that millennials are being diagnosed with are diabetes type 2, as well as high blood pressure. And of course, other generations are also plagued with these diseases, Gen X, baby boomers, the silent generation. You know, tens of millions of Americans and people all over the world have these two diagnoses. And when you read about prevention of heart disease and prevention of strokes, which are, you know, heart disease being the number one killer of people all over the globe, what we read about is that once they get diabetes and once they get high blood pressure, we should very carefully control those diseases so that we can prevent heart attacks and strokes. And I always thought that was kind of odd to wait for someone to get one disease and then treat that to prevent them from getting another disease that might kill them. And so I wanted to talk today about how to prevent diabetes itself, how to prevent high blood pressure itself. You know, we often get confused about what prevention actually is. And in medical school and in residency, again, we were taught that there are two types of prevention. But in practice, we only use one other type of prevention. So we were taught in medical school that there is type 1 prevention and type 2, or secondary prevention. Primary prevention is you never get a disease, like you never actually get sick. You don't ever get the diabetes that puts you at risk for having the heart attack. You don't ever get the high blood pressure that puts you at risk for having the stroke, right? We call that primary prevention. Secondary prevention is when, you know, the horse is out of the barn and now you've been diagnosed with a disease and now we're scrambling to try and prevent you from dying. You know, from that disease or having a much more severe consequence of having that disease. So for example, diabetics having heart attacks or people with hypertension having strokes or vice versa. You know, people with hypertension can also have heart attacks. People with diabetes can also have strokes. And so we call that secondary prevention. Once the horse is out of the barn, you've already been diagnosed with a condition, and now we're trying to prevent you from dying from that condition. That we call secondary prevention. So what we're preventing is your death at that point, as opposed to primary prevention, where what we're preventing is the illness itself, you actually getting sick. And so in clinical practice, we kind of shove primary prevention out of the way, and we only do secondary prevention, which I always thought was a little bit odd. And even in fields that are preventive by their nature, we're still not doing as much as we probably could to help prevent the primary conditions, diabetes and high blood pressure, that lead to the heart attacks and strokes that actually kill people. So diabetes itself is not what kills you. It's the heart attack that kills you. It's the stroke that kills you. It's potentially the diabetic coma that kills you, or the infection that you can't fight off because your immune system is so weak when you have diabetes. And so I tried to find studies before the podcast to see if are there any studies about preventing diabetes itself, preventing high blood pressure itself. Why are we not using this approach as opposed to just, waiting and shrugging our shoulders for someone to get diabetes and high blood pressure and then to medicate them so that they don't get something worse. And so there weren't that many studies. So they are looking at some studies, starting to do some studies on, different things to see if maybe those types of interventions might help. So one thing that was studied fairly well was the Mediterranean diet. So the Mediterranean diet has been proven in studies, is shown in multiple studies to help reduce blood sugar in diabetes, and also to prevent diabetes. And so people that follow a Mediterranean diet tend not to have the same incidence of diabetes as people who follow other diets. In America, we have the SAD diet, the standard American diet. And people that follow that diet have a very high prevalence of diabetes and high blood pressure, whereas those who follow other diets, vegetarianism is another example of a diet that helps to minimize the risk of diabetes. And so once someone has diabetes, we will medicate them and, of course, do dietary interventions. And so I tried to find some studies to suggest, whether or not those specific interventions were actually useful for preventing heart attacks and strokes, because we do them based on what we think might be logical, but we don't really have a lot of evidence to show that once someone is diagnosed with diabetes, whether or not controlling their blood sugar actually helps prevent a heart attack or a stroke. And in fact, the studies are kind of all over the place, and they're not conclusive about whether or not controlling blood sugar once you've been diagnosed with diabetes actually helps prevent a heart attack or stroke. And in fact, it really kind of doesn't, unless you very strictly control your blood sugar. And very strict control of blood sugar has a bit of a dark side too, because then you can over-medicate and go into diabetic comas and other situations where your blood sugar will drop too low, and you could potentially pass out and get quite sick from that. So there's of course danger from having high levels of blood sugar, and then there's danger in having levels that are too low. And so there was one study by the New England Journal of Medicine that showed that very strict control of blood sugar was useful in preventing complications of diabetes, but it was only that one study. Most of the other studies are inconclusive. In other words, it doesn't seem to matter whether or not you control your blood sugar. Once you're diagnosed with diabetes, it doesn't seem to matter as to whether or not you're likely to have a complication from diabetes. So for example, blindness, kidney disease, the most deadly being heart attacks and strokes. And so again, that really emphasizes the idea that waiting until people have diabetes to intervene is a very bad idea. And this is why we continue to have these huge incidences of heart attacks and strokes and diabetes and high blood pressure in our society, because we're not really getting to the heart of why people get those conditions. And so what do you do when you don't have a lot of studies, right? We don't quite know how to prevent diabetes except to tell people to eat better and exercise. And unfortunately, that doesn't seem to be working, right? So what do we do under those conditions, right? And so for me personally, as an integrative medical doctor, I always look to Chinese medicine for the answer. Chinese medicine knew the answer thousands of years ago, and we're just starting to study from our own perspective in our modern scientific terms what the cause of diabetes is. And in Chinese medicine, they don't necessarily say that the patterns that they diagnose are the cause of a disease, but they flow together so that if you treat the pattern, the disease will get better. And what they call diseases, we would call symptoms. So they don't have necessarily a disease in traditional Chinese medicine called diabetes. What they have is a disease called frequent urination and thirst. So they don't wait for people to get diseases, and in fact, they don't even have these same terms in their medical terminology. They will treat someone when they have increased frequency and thirst, which we know as symptoms of diabetes. And so these are what they look for the causes of to actually treat. And so when I looked at different patterns, to refresh my memory on all the different patterns for diabetes, what we call diabetes, what they call frequent urination and excessive thirst, the liver was very heavily involved with diabetes. And again, the liver in traditional Chinese medicine is not what we think it is in our modern scientific terms, but it is part of it. But the liver in Chinese medicine is an energy field. It's not a physical structure. Although it includes the physical structure we call liver, it's an all over the body type of energy. And in traditional Chinese medicine, they say that stress impacts the liver directly. And so we know that we know that in our modern science as well. For us in modern medicine, the liver is the main detoxification organ. They recognize that in traditional Chinese medicine as well. But in addition to that, they also say that the liver controls circulation. So in our modern medical terms, we say the heart controls circulation. But in traditional Chinese medicine, they say that the liver controls circulation. And what they mean by that is everything that's circulating in your bloodstream is controlled by the liver. So blood sugar is controlled by the liver, according to traditional Chinese medicine. Hormones are controlled by the liver, according to traditional Chinese medicine. Anything pretty much that is transported in your bloodstream is controlled by the liver in terms of concentration, in terms of how much will be in the blood to be circulated all around your body to function. And so liver was heavily involved in the patterns that are used in traditional Chinese medicine. And so what does that mean, right? So I started to look at this in terms of, are we studying this in our modern medicine? And we're not yet. So the first thing that came to mind was antioxidants. Antioxidants and the lack of antioxidants is a source of a lot of diseases. It's the reason why vaccines don't function to prevent infection, because we rely on antioxidants to protect our mouth and nose. Vaccines obviously would not provide that type of support, right? And so even when you're vaccinated for anything, flu vaccine, anything at all, you also have to support your antioxidants in your body to prevent viruses and bacteria from entering through the mucous membranes in the first place. So a lot of the reasons we get sick at all is because of antioxidant deficiencies. And again, these you would find typically in fruits and vegetables. Those aren't the only types of foods you'd find them in. You also find them in legumes, nuts, seeds, are loaded with antioxidants. And, in our country, we don't eat a lot of fruits and vegetables. And so we tend to become antioxidant deficient. The other reason we become antioxidant deficient is because we have too much stress. And so stress puts a lot of pressure on your antioxidants because you use up a lot more oxygen under stress, right? All of the chemical reactions that handle stress are activated under fight or flight. And so you're using a lot of resources, much more than if you were calm, right? Obviously, because your body thinks it's going to run away from something or fight against something. So it's going to start pouring out fight or flight hormones and neurotransmitters and chemicals all over the body to prepare itself. Chronic stress is the same way. It's just now your brain has talked itself down from panicking, but you still have the signals going down into the cells. So the cells are still preparing for a fight or flight response, but your brain is tempering the response. So you don't feel panicky, but your cells are panicking. That's chronic stress. That impacts the liver directly. And so what that does is that puts a burden on the liver to clean up. So it's like a bull in a china shop, right? So if you let a bull loose in a china shop, you're going to have a lot more to clean up than if you allow, people, adults who are very careful with china in the china shop. Right? You're not going to have as many plates and cups broken at the end of their time in the china shop as you will if you let a bull in there. So it's the same with stress. So if you're under stress a lot, that's the bull in the china shop. It's going to run all around and create damage. And you're going to have to clean up all that damage. What cleans up all that damage are your antioxidants, because they are what keep the cycle of cleaning going. So your body is very well equipped to deal with stress. It's very well equipped to deal with toxins. But if there's too much, if the system is overloaded because you're under chronic stress for too long, you're going to overwhelm the system that defends you and cleans up after the stress. And then you're going to have a mess, right? And antioxidants are what reset that system. So the cleanup system when you are under stress is partly your liver. All of your cells have the ability to clean themselves as well. But your liver is the one that cleans up everything that's in your bloodstream. So once your cells clean stuff up, they shove them outside of themselves. They go into the bloodstream, they go into the liver, and the liver does all of the final cleanup work that will restore the body to its original healthy state. Now, antioxidants are what reset the switch, so they're kind of like recycling. They're the recyclers that get everything back up and running so that when the next, fight or flight response comes, everything's reset and ready to go. If you have antioxidant deficiencies, that system will not be reset. And so you will not have a brand new cleaning crew at the ready the next time you need them. And then again, all that mess is just going to come in and happen and nothing is going to get cleaned up. Eventually, what that does is that breaks your cells. It breaks your body. And we call that reactive oxygen species. And then that begins to damage the cells themselves because there's nothing to clean them up. Right. And so they become damaged when there's that much, garbage to clean up that doesn't get cleaned up and removed from the cell. So the walls of your cell, the borders of the cells get damaged. And the borders of cells also include your blood vessels. So when people have heart attacks and strokes, it's because the walls of the cells that line the blood vessels that create and make the blood vessels have gotten damaged. And then they get sticky and nasty. And then when you have high blood sugar on top of that, makes everything stick to those damaged walls, right? And then that's what leads to the stroke and the heart attack. And so if we want to intervene before someone has diabetes, we have to look at antioxidants and we have to look at mitigating stress so that the system doesn't get overwhelmed. And then look at what resets it, recycles those systems, which are antioxidants. And so we'll talk a little bit more about how to get those in your diet, how to supplement properly for antioxidants, and I'll also explain how antioxidant deficiencies can also lead to high blood pressure. These things are being now studied. They're not well studied yet, but there are several studies that I saw today that are underway looking at antioxidants and free radicals as a source of diabetes and high blood pressure. So you're listening to Awaken Wellness Now. I'm your host, Dr. Mylaine Riobe. We'll be right back.
What happens when we begin to realize that the 200-year experiment we've called the American healthcare system has failed? Learn how spirituality, ancient traditions, and cutting-edge science are merging to create a new paradigm of wellness on Awakened Wellness with Mylaine Riobe, MD. Tune in every Wednesday at 12 a.m. and 12 p.m. Eastern Time with live video shows every first and third Wednesday at 12 p.m. Eastern, when you can call in and ask Dr. Mylaine the questions that matter most to you. Dr. Mylaine is the medical director of the Riobe Institute of Integrative Medicine in Jupiter, Florida. For more information, visit RIOBE-integrativemedicine.com. Dream Vision 7 Radio Network invites you in for this dynamic, forward-thinking show.
Join Dr. Bernie Siegel on Mind Health Matters every Thursday and Friday, 12 a.m. and 12 p.m. Eastern Time on syndicated Dream Vision 7 Radio Network. Bernie will draw from his inspirational personal journey, offering us special nuggets of his sacred wisdom weaved through his delightful stories. Listen in as Bernie reminds us to be fully engaged in life.
Ever wonder what it's like to have your own radio show? Well, wonder no longer, because you can dip into the radio airwaves by being host for the day on syndicated Dream Vision 7 Radio Network. It's a fabulous way to get your radio feet wet. It's an opportunity to market your business, modality, or book. Have a guest, mention a sponsor, and take callers. Or you may want to facilitate a lesson by going solo. It's up to you. Listeners can be online, mobile, in cars with Bluetooth, or listen through Amazon's Echo by asking, Alexa, play Dream Vision 7 Radio Network. For more details, go to dreamvision7radio.com and click on Host for the Day.
Delight your kids with an enchanting journey by reading the Paper Doll Kids children's book by Deborah Beauvais and Janine Sullivan. There's even a catchy tune, Kids for Love Song, produced by Bob Sherwood and sung by kids just like yours. The story weaves around 7 paper dolls flying around the world doing good deeds as they bring important attention to our endangered animal friends. There's even a magical ring with a universal message. Kids become interested in service projects, action through compassion, and planting seeds that nurture positive change. The Paper Doll Kids and Kids for Love Song are a production of the Kids for Love Project. Get the book now on Amazon Kindle and the song on CD Baby or iTunes.
This is Dream Vision 7 Radio Network, uniting mankind with universal love. Our shows are created from the heart, bringing each listener to a place of divine enlightenment. Breathe, relax, and enjoy. Let life flow.
Welcome back to Awakened Wellness. I'm your host, Dr. Mylaine Riobe. And today we're talking about how to prevent type 2 diabetes and hypertension or high blood pressure. I think that should be the change in our focus, in particular for millennials, because they're being diagnosed by the thousands every day. And so this is, again, it's a lot about stress if you look at it from a Chinese medicine lens. So we relate obesity, gaining weight to diabetes and high blood pressure. And we assume that it's the gaining of the weight that has caused the diabetes and the high blood pressure, when in fact, it's actually that they just flow together. It's not that the being overweight is causing the diabetes or the high blood pressure. It's that they just happen to happen together because of the stress and the impact of the stress that causes the weight gain. The impact of that same stress also causes the diabetes. And the impact of that same stress also causes high blood pressure. And so, again, if we go down to the root of what's really actually going on from a Chinese medicine perspective, this is about stress. And it's about the overwhelming of the body from stress. And again, it doesn't have to be stress that you identify, like I'm stressed out because I lost my job, or I'm stressed out because of, family situation or whatever. It's also the toxins in the atmosphere, right? It's the 80,000 chemicals that are floating around in our soil, in our water, in our air, that seeps right through the body, into us. That's also a stress for your body. Just because you don't see it and you don't smell it, you don't taste it necessarily, doesn't mean it's not coming in. It doesn't mean it's not impacting all of your detoxification systems, but the most critical one being the liver, in terms of the one that actually raises the risk of diabetes and obesity and high blood pressure. And so, again, how do we use this information to help to start to turn the tide, right? And it's all about, how do we manage our stress? How do we bolster the liver so that it's able to do its work more effectively, right? And of course, the number one way is through our nutrition. And supplements have been shown not to be as effective because there's only so many supplements you can take, right? And if you don't have really comprehensive testing to know which supplements you need, you're just guessing. And so it's no big surprise when studies come out and say supplements don't work for the treatment of diabetes or high blood pressure, because there's so many different options of supplements you can take. And it's really hard to take all of them, right? So the only way you would actually know is to be tested, right? And only through the field of integrative medicine so far can we actually be tested in a comprehensive way. Well, we'll get a full report of all nutrients and minerals and antioxidants. So there is a lab that actually tests for antioxidants, about, I think, 9 or 10 different antioxidants, minerals, amino acids, vitamins, and they'll give you a full report of which ones you're deficient in. And then you take those specific supplements at the recommended doses, right? So now you're using your food, right? And then you have a comprehensive report that tells you what your food is not covering for you so that you supplement that. And then now you're going to raise all of the necessary and critical antioxidants so that your body can better function and better recycle and reset its detoxification systems. So antioxidants are kind of a reset of the detoxification systems. And so it's really important to eat a ton of vegetables and to vary them, right? So, so many foods, hundreds and hundreds of different foods qualify as antioxidants, and they all work just a little bit differently, right? Nature is really smart. It has a lot of overlap in what it does. So for example, if you look up the functions of thyroid hormone, you'll see a bunch of functions listed there, hundreds. If you look up the function of cortisol, you'll see very similar functions to thyroid, right? And yet they're two different hormones with different functions, and yet there's tremendous overlap between them because nature's smart. It's the same thing with vitamins and minerals and antioxidants. So there's a ton of overlap with antioxidants, but they're all just a little bit different too. So that way, if you're eating a varied diet, you're covering all bases. And so if you happen to be deficient in a particular food, there's all types of other foods that if you eat enough of them, you'll compensate for being deficient in that one food, right? Nature's smart in that way. So you want to eat a very large amount of varied vegetables. I tend to minimize the fruit side because it's just pure sugar. And if you're already at risk for diabetes and high blood pressure, you don't really want to pound down a lot of fruit. So you want to stick with the green leafy vegetables, the brightly colored vegetables. And then you can still have some fruit. I tell people you can have a handful of berries. It's not a problem. They're very good, rich antioxidant sources, cranberries being probably the richest of all the berries in antioxidants. But very bright colored vegetables are top of the list. And then some berries would be next. Nuts and seeds also have a lot of very high antioxidant capacity. I'm proud to say, as a coffee fiend, that coffee has a very high antioxidant capacity, as does green and black tea. And the other piece of this puzzle, right? So when we look at diabetes from a traditional Chinese medicine lens, it's not just the liver being affected that leads to the diabetes diagnosis. It's also the acidity. So when we look at the patterns in Chinese medicine that are associated with what, again, they call frequent urination and excessive thirst, there's a lot of heat involved. So we'll see terms like fire and heat transformation in the patterns according to traditional Chinese medicine. Heat and fire are basically what we would translate in our modern medical terms as acidity. And so an alkaline diet for people that have heat signs. So you don't want to do an alkaline diet if you have a cold dynamic metabolic type. It would not suit you. You would not feel well doing that. So for people that have a hot dynamic metabolic type, an alkaline diet would be very useful in reducing your body temperature and the acidity overall in your body. And that would go a long way towards preventing the acidity that can lead to the diabetes. And so again, for one of our podcasts was about dynamic metabolic types. So you can go to my website, awakenedwellnessnow.com. You can also take our Wellness Warrior burnout assessment to know what your dynamic metabolic type is. So if you have a hot dynamic metabolic type, an alkaline diet will be very beneficial because it's a cooling diet. So alkaline foods will cool you down. If you're too cold, you don't want to cool yourself down more because it's all about balance. Chinese medicine is all about balance. So even if you have 5 people in your family with diabetes, you have a cold dynamic metabolic type, you don't want to do an alkaline diet. But you do want to have very well cooked foods in that case. So you might want to do a broth, and you throw all those brightly colored vegetables in that broth and you drink it so that it's warm. So you're still getting a ton of antioxidants in your diet, but you're also balancing your temperature. So it's really important also to know what your dynamic metabolic type is, so you know if an alkaline diet suits you or not. If an alkaline diet doesn't suit you because you have a cold dynamic metabolic type, just make sure that those vegetables are cooked. That's really important. So those are the main ways, that I believe studies will eventually show this, but based in traditional Chinese medicine, if you have a hot dynamic metabolic type, cool yourself down with an alkaline diet. Either way, crank up the antioxidants in your diet. And you can Google them. They're easy to find, antioxidant foods, but as a broad category, very brightly colored leafy vegetables, huge in antioxidant capacity, nuts and seeds, walnuts in particular, very high antioxidant capacity. A lot of different herbal teas have very high antioxidant capacity. And then again, fruits, in particular berries, are going to have tons of antioxidant capacity. The other side of the coin, right? So the one side of the coin is I got to keep up with my antioxidants so I don't run low. The other side of the coin is I got to minimize the impact of stress on my body so that I don't overwhelm the system, right? And again, that always boils down to the same things, right? Breath, breathing, making sure that you're breathing properly, because breathing oxygen in a calm fashion is very different than gulping oxygen down in a stressed fashion. So again, heart math breathing is another really critical tool for millennials to learn, and Generation Z as well, to minimize the impact of the stress on your body. And then detoxing your home. Actually, our next podcast in a couple of weeks is going to be all about detoxifying your home, removing toxins from your home. So I'm not going to go into that too much today, but that's another piece of the puzzle, is making sure you're not swimming in toxins. And then eating organic foods as much as possible. In particular, when you select your fruits and vegetables, you want to make sure that they're organic, because if you're not eating organic fruits and vegetables, you're kind of defeating the purpose, because you're bringing in a lot of pesticides. And so you're actually loading your body with more toxins to have to deal with. So make sure your fruits and vegetables are organic as much as possible. And I know that debate always rages on, that's because our organic regulations here in the United States are very lax, but still better than having non-organic fruits and vegetables. So I highly recommend that. I think we had some questions. Let me make sure I get to at least a couple of them. What are my risk factors for high blood pressure and diabetes? Yeah, so that's what we're talking about, right? I think we will learn eventually that the biggest risk factor is stress. According to traditional Chinese medicine, the liver is very heavily involved, and it is the stress organ, according to traditional Chinese medicine. I think we'll also learn that acidity is at the heart of a lot of diabetes and high blood pressure as well. The liver is also very heavily involved in high blood pressure in Chinese medicine patterns as well, as is the spleen, which is kind of loosely related to metabolism in our modern medical terms. The spleen in Chinese medicine makes energy, vital energy, and blood. So it's responsible for our metabolism, how we make and use energy. Now, in our mainstream medicine, those risk factors are going to be a family history, right? So if you have relatives with those conditions, you're more likely to have those conditions as well. And I think that's more because of shared diets, shared mindsets. There aren't any genes particularly that we can isolate to say this gene causes, diabetes specifically, and that's why it runs in the family. So we know that these conditions are to a very large extent, more environmental than genetics. So it's important, even though it's running in the family, it's a risk factor because you learned your behaviors from your family members. You learned how to eat from your family members. You learned what you believe from your family members. And so that trickles down. And so if you don't change that pattern, if you don't break that cycle, you end up in the same boat as your family members, right? So it's about breaking those cycles and, learning to eat differently, learning to breathe differently, learning to live differently, which is hopefully what we're going over today. Let's see, we have so many questions. What can I do to reduce my risks of complications from high blood pressure and diabetes? Yeah, so I think this is exactly what we're talking about today. Just making sure you have a very clean diet, rich in antioxidants. Now, if you have a really hot dynamic metabolic type, an alkaline diet or even going vegan for a while until your dynamic metabolic type neutralizes, right? Until your body temperature is back to normal. If it's too high, you got to bring it back to 98.6. So if you're always hovering at 99 point whatever, and your doctor always thinks you're sick because your temperature is never normal, it's always a little bit too high, you're going to benefit from a vegan or a vegetarian or an alkaline diet. Anybody can benefit from a Mediterranean diet. It's pretty neutral in terms of temperature. So anyone can benefit from doing a Mediterranean diet. But again, just make sure a lot of organic food. Exercise is another big one, right? Making sure that you're moving efficiently. And again, once you know your dynamic metabolic type, you can know more specifically what exercises to do. So if you have an excessive dynamic metabolic type, you want to do exercises that are a little bit more aggressive, like high intensity interval training or boot camps. If you have a deficient dynamic metabolic type, you do not want to do those types of exercises because they will tear you apart. So you want to do more restorative exercises like yoga or Tai Chi or Qigong if you have a deficient dynamic metabolic type. And then, of course, reducing processed sugars, right? Reducing processed foods, period. Making sure that everything you eat is as clean as possible. Making sure you have enough protein in your diet's another big one, because protein balances blood sugar. So if you have a very low protein, amount in your diet, your blood sugar tends to spike more and stay a little bit higher than it should before it comes back down. Whereas if you have sufficient amounts of protein, your blood sugar is more stable. And so those are some methods to help reduce complications. And again, as clean as you can possibly get those food sources. Let's see, there are so many other ones. What are the side effects of the treatments for high blood pressure and diabetes? Yeah, so side effects of treatments for high blood pressure are low blood pressure, right? So you want to be very careful not to have your blood pressure go too low on medication, because you can pass out while you're driving. You can have a stroke from that as well, not getting enough blood flow because there's not enough pressure to get to your head. So that's why people will tend to get dizziness. Your body wants you to go horizontal so you can get oxygen and blood to your head. It's a lot easier when you're flat than when you're standing up or sitting up. So if you drop your blood pressure too low with medication, you're going to feel dizzy because your body wants you to lay flat. And then for diabetes, it's either it's over medicating and having your blood sugar drop too low. You could have a lot of untoward effects from that as well. So it's really just a matter of balancing the medications to make sure that you have a dose that it's not too high, it's not too low, and you have a nice sweet spot. The problem with that is the studies will show that you have to have a very strict control over your blood sugar to prevent those complications. And so this is why we can't wait till somebody has diabetes and then come in and think we're going to prevent a stroke or a heart attack. We have to actually prevent the diabetes itself. There's a really good study done about maybe over a decade ago now on low protein diets and the increased risk of diabetes in rat offspring. And why this study was so important is because rats and humans are very similar. And we both have that specific gene that they were looking at. And now that gene doesn't cause diabetes by itself. But if that gene sits in an environment where there's not enough protein in the diet, it will trigger diabetes. Now, again, that doesn't mean it's genetic. That's environmental. The environment around the gene caused it to behave in a certain way that led to a disease. That's not classically genetic. That's more environmental. So you can alter whether or not your body expresses that gene by just eating enough protein. So those are some ways. And then question, I've been reading about waves of illness in large populations, maybe due to group dynamics, similar diets, similar faiths. Have you heard of these waves? I've not heard them in people. I've heard them in trees. But I know for trees, they communicate through obviously the electromagnetic field, as well as there's a whole ecosystem of fungus under the ground that they communicate through. And that's how one tree will know that another tree miles and miles away is sick. And it will be able to mount an immune response and protect itself. I would imagine the waves of illness, I don't know what the mechanism would be specifically, but again, we talked about mind versus brain in our last podcast, and mind being a collective consciousness. So there's, again, a way that we communicate with each other without speaking at large distances. So I can imagine that the same would happen with shorter distances. And again, we become what we think, right? We become what we believe. And so if someone gets sick and we suddenly start to fear that disease or that we might get sick too, we actually start to increase the risk of getting that disease, right? So just because you fear and resist something doesn't mean you're going to keep it away. You actually increase the likelihood of it because of the fear and the belief. So we wouldn't be afraid of a disease if we didn't believe we could get it, right? And so it's the belief that we can get it that also contributes to actually getting it. So again, this is why I love heart math and meditation. We can quiet the brain that says, oh my God, so-and-so just got sick. That means I can get sick too, right? The mind knows you don't have to get sick. You can stay healthy. And it knows that it's very possible, but the brain doesn't, right? The brain's always calculating survival. It's like, oh, if we get sick, what's going to happen? We might die and bad things will happen. And it starts to fear, whereas the mind doesn't fear anything. And heart math breathing helps the mind to take over and to control the brain like a little puppet. Otherwise, the puppet runs amok and does whatever it does. And so you have to do the heart math breathing to help bring the brain under control. So that would be a mechanism that I would assume would be at the heart of why, we call that also groupthink mentality, right? Gang mentality. When people are in a group, they behave differently than when they're isolated by themselves, right? There's a psychology there as well. So I think that's what that's about. I don't have any solid proof of that. So statement, your breathing exercise helps me get my heart rate back to normal during the time it begins to flutter a bit. Thanks for sharing that golden advice. Yeah, that's like one of the most critical foundational things to do is breathing, right? If we don't breathe properly, we set ourselves up to get sick. And so, we plant fertile ground for disease if we're not breathing properly. And so part of why the antioxidants become deficient is because we're not breathing right. If you take a gulp of air or a short, shallow breath, you're sending a signal to your body to panic. Even though your brain doesn't see a reason to panic, if you're not consciously breathing in a way that is calm and through the nostrils, in a long, deep breath try and do it for 5 seconds if you can, as often as you can remember. You're sending calm signals when you do that. If you take a short breath, you've just told your body to panic, right? Now you can override that by taking a nice long breath after and remembering to do that more and more and more. Your body can heal itself. It really can. As long as it has the proper nutrition and everything that it needs, it will do so. So we need to get to our second commercial break. You're listening to Awakened Wellness Now. I'm your host, Dr. Mylaine Riobe, and we'll be right back.
What happens when we begin to realize that the 200-year experiment we've called the American healthcare system has failed? Learn how spirituality, ancient traditions, and cutting-edge science are merging to create a new paradigm of wellness on Awakened Wellness with Mylaine Riobe, MD. Tune in every Wednesday at 12 a.m. and 12 p.m. Eastern Time with live video shows every first and third Wednesday at 12 p.m. Eastern, when you can call in and ask Dr. Mylaine the questions that matter most to you. Dr. Mylaine is the medical director of the Riobe Institute of Integrative Medicine in Jupiter, Florida. For more information, visit RIOBE-integrativemedicine.com. Dream Vision 7 Radio Network invites you in for this dynamic, forward-thinking show.
EDECIA is a U.S. nonprofit dedicated to the dream of ending childhood malnutrition for millions of children around the world. Through the manufacture of Plumpy Nut and other nutrient-rich peanut-based ready-to-use foods, EDECIA has already delivered life and hope to nearly 1 million children in over 26 developing countries. To find out how you can join EDECIA's dream of ending childhood malnutrition, please visit edeciaglobal.org.
What if dreams can diagnose your life? What if we can meet the love of our life in dreams? Join host Kat O'Keefe Canavas, the #1 internationally best-selling author of Dreams That Can Save Your Life, written with Duke University medical doctor Larry Burke. Dreaming Healing is where we'll explore dreams, research, and interpret dreams from you, the caller. Dreaming Healing shows can be heard every Tuesday at 9 a.m. and 9 p.m. Eastern, with live shows on the first and third evenings at 9 p.m. Eastern, 6 p.m. Pacific Time on syndicated Dream Vision 7 Radio Network. Come live your dreams out loud with Kat.
Are you searching for a way to help create global change? Dream Vision 7 Radio Network's vision is to have an eclectic group of radio hosts dedicated to educating, enlightening, and helping humankind with positive messages and tools that enhance lives using different modalities and programs. If you would like to join our team and help illuminate the universe, call Deborah at 508-226-1723 or Deborah at dreamvision7radio.com. This is Dream Vision 7 Radio Network, uniting mankind with universal love. Our shows are created from the heart, bringing each listener to a place of divine enlightenment. Breathe, relax, and enjoy. Let life flow.
Similar. So we talked a lot about diabetes today, but high blood pressure is also a mostly stress-related situation. And of course, when we have acute stress, our blood pressure will go up, right? And eventually what happens is it keeps going up. And under chronic stress, and again, this is not, we don't quite know what causes high blood pressure. So sometimes it can be a kidney problem. Sometimes it's dietary, right? If we eat foods that are not healthy for us, blood pressure will creep up. If we have a lot of chronic stress, blood pressure will creep up. And so the problem with blood pressure creeping up is that it puts pressure on the cells that line the blood vessels that feed your whole body, but very specifically your heart and your brain. So you're increasing the risk of stroke as those cells get damaged from the increased pressure that the body has to exert to move things through them. They get damaged and they get sticky, and then they form plaque. And then potentially you can have a heart attack if the plaque is formed in a vessel that feeds your heart to the point where it blocks blood flow entirely. Same thing in the brain. If the same thing happens in the brain, you have a stroke for that reason. And so if you look at the patterns of disharmony in traditional Chinese medicine, they're a little more complex. You know, they don't all point to the same thing. Like with diabetes, it's the liver and heat. With high blood pressure, it's different. There are a lot of different potential causes having to do with liver being one big one, metabolism, or what in Chinese medicine we would call the spleen, being another one, not making enough energy, you know. And so we would potentially equate that with gastrointestinal system and not quite being able to make energy. So we make energy from the food we eat and the oxygen we breathe. And then that gets distributed and the body converts that into energy that it then uses to perform its functions. So a lot of the patterns in Chinese medicine have to do with deficiency of liver and kidney, sometimes spleen. And so we get inflammation from that. We get acidity from that as well. And then we get just low metabolism, and the body just can't quite move things around. Another interesting thing that we see in Chinese medicine is a concept called blood stasis. And it's the obstruction, not of the big vessels that cause the heart attacks and the strokes, but it's the obstruction of the tiny, tiny little vessels, the capillaries. And we don't measure that with blood pressure cuffs. We don't really have a way to measure that. We can see it and we can feel it in someone's pulse. And so if someone sticks their tongue out, their tongue will look a little bit on the purple side. And if they turn their tongue upward and you look at the veins underneath their tongues, you'll see that they're kind of bulging and a little bit purple. And when you feel the pulse, it will feel kind of like tight and ropey. And you can feel the stress in the pulse. So we know that they have blood stasis under those circumstances. So what happens when the tiny little vessels in your body are obstructed and blocked, and it's much easier for them to be obstructed and blocked than for the bigger blood vessels, clearly. What happens is your body has to push harder to get blood flow through those tiny little vessels. So your body has to make your blood pressure go up in order to shove blood flow through those tiny little blood vessels. And so cleaning out those tiny little blood vessels, again, those are your antioxidants jobs, right? So all the different antioxidants that you take, they clean out the junk that tends to accumulate in the tiny, tiny little capillaries and blood vessels. And so again, antioxidant support is really important because a lot of times it's blood stasis. That tends to be the principal pattern of disharmony. There are many in Chinese medicine, but that tends to be one of the more common ones. And again, it's not an obstruction of the big blood vessels. It's an obstruction of the tiny ones. And so again, eating properly, exercising so that your body pushes through those vessels is also very important. moving your body so that your body is constantly moving things through those smaller blood vessels so they don't have time to get blocked and obstructed and gunked, right? So that's really important because it just makes sense. If you have obstruction in the smaller blood vessels, you're going to have to push harder to get blood to flow through. And that means your blood pressure has to go up. And so a lot of high blood pressure, I believe, we will find eventually is due to the obstruction of those tiny little vessels. And so again, eating right, breathing properly. When you take a deep breath, you actually open those small blood vessels just by default. That's just how your body works. So breathing, proper nutrition, exercise always boils down to the same things. So thank you so much. We're running out of time. Again, so many thoughtful questions and statements and comments. So apologies for the technical difficulties today. Until next time, many blessings. Thank you for listening.
Join us next time on Awakened Wellness with Mylaine Riobe, MD, to learn how spirituality, ancient traditions, and cutting-edge science are merging to create a new paradigm of wellness. Awakened Wellness airs every Wednesday at 12 a.m. and 12 p.m. Eastern Time, with live video shows every first and third Wednesday at 12 p.m. Eastern of each month. Meanwhile, you can join our Facebook page at facebook.com/awakenedwellness and let us know what you'd like to discuss on future episodes. Dr. Mylaine is the medical director of the Riobe Institute of Integrative Medicine in Jupiter, Florida. For more information, visit riobeintegrativemedicine.com. This show is part of the Dream Vision 7 radio network.
This is Dream Vision 7 Radio Network, uniting mankind with universal love. Our shows are created from the heart, bringing each listener to a place of divine enlightenment. Breathe, relax, and enjoy. Let life flow.